Okay, let's keep going. So let's look at your white blood cell. The white blood cells, you have the non-specific defense. So old white blood cell, their main function is to fight the pathogen. So some of them, they belong to the non-specific, like the pretty famous one, neutrophil, the most abundant white blood cell, and eosinophils, and macrophage cells. And every time they see anything suspicious, they will go to fight them. And also you have the nature killer cell. That's the one of the lymphocyte, and like the police, they travel in your whole body, and if they see anything like the virus infected cells and cancer cells, they will kill them. Now let's look at the specific immune. You have the innate immunity, like you were born with it, and you also have the acquired one. Acquired one is mainly the B and the T lymphocyte. You can active acquired immunity. You can have the active and acquired immunity, but this one require you to expose to the antigen. So that's when you get sick. This antigen can get you very sick, and your body get the immunity of it. Your B cells, T cells get activated. You can also have the passive one. So let's look at the size. Your immunity, you can have the innate one, you can have the acquired one. Acquired one, you can have the active immunity. So that's when the pathogen go into your body and you survive. You get sick because those pathogens can make you sick, but your body develop immunity. That's this one. And you can have the passive one. One important passive one is from the breast milk. So the mom breastfeed your baby, and not just give your baby food. Also, you can give those antibody to your baby through the breast milk. And because you have the specific, non-specific immune, this part talk about the specific. So you have the T lymphocyte, B lymphocyte, so they're able to fight the pathogen, so specific defense. And the B lymphocyte produce antibody. And the T lymphocyte, that's the one directly go to attack the pathogen. And this specific immune system need to be activated. So let's look at the T cells. The T cells is the one really do the combat. So they will go to fight the pathogen. And they need to be activated. So they're activated is they can directly touch the pathogen, or they can go to the macrophage. Macrophage is the white blood cell that always fight the pathogen. And after your white blood cells fight the pathogens, they will put some structure of the pathogen on the cell membrane. And the T lymphocyte can touch those structure and they will be activated. And once they are activated, they are able to go to fight the pathogen directly. Your B lymphocyte is like the Air Force. They throw bomb. The bomb is called the antibody. So they will produce antibody. When you get immune shot, you try to activate the B cells, produce the antibody, specific target the pathogen. So that's B cells activation. They touch the antigens and they will be activated so they can produce antibody. Antibody will specifically target the antigen and help the immunity. And those specific immunity require time, so it takes a while to learn. And the first time your body have the antigen, you have the primary response. And this one is when your body is still learning. It takes a while. So it takes a while to produce antibody. It doesn't produce that much. But the second time, when the same antigen comes, your body go to the secondary response. And this one is much quicker because your B and T lymphocyte, remember it, they can quickly produce a lot of antibody and target those antigens. And that's why we got the flu shot, because we want our body learned this already. So when you get the flu shot, you give them antigen, and it takes about 2-3 weeks for your body to respond. So during those 2-3 weeks, your body are learning, and your B and T lymphocyte will learn. Okay, they will remember those pathogens. And the next time, so when you get the flu shot, it takes about 2 to 3 weeks. You have the primary response. That's when your body produces a little bit antibody. and your body are learning. So after you get the flu shot, the real antigen comes. Your body is in the secondary response already, so it can produce a lot of antibody very quickly and to fight the pathogen. So that's the purpose you got the flu shot and other immune shot. I'll leave this to you, and let's bring us to the summary. So your body help you to fight the pathogen, antigen. This is the same. You have those specific, non-specific immune. So the white blood cell, most of them are the non-specific immune, and the lymphocyte, they are the specific immune. So in this chapter, we mainly talk about the B lymphocyte and T lymphocyte. And the B lymphocytes, they are like the Air Force. They produce the antibody and attack the pathogen. And the T lymphocyte is like the Marine. They really go to do the hand-in-hand combat and directly contact and kill those antigen. Because so many layers of protection, your body is normally pretty healthy. And let's look at the immune disorder. So autoimmune disorder definition is your immune system become over-activated. They go to attack your own tissues. So in the nervous system, we talk about multiple sclerosis. That's when your immune system attack the oligodendrocyte, the one create the myelin. And you can have the immunodeficiency like AIDS, acquired immune deficiency syndrome. And that's when you don't have enough T lymphocyte to attack the pathogen. Allergy is your body response to those neutral response. They're overactivated. Like this antigen is not really antigen, it's neutral. Pollen, your body responds to it, and your body have the overreact response. And age-related is when you're getting old, your immune system become weaker. And let's look a little bit of AIDS. AIDS come from HIV virus. HIV virus is a virus come from chimpanzee, and in chimp it's called SIV. It's not a very serious virus. They live with them like forever. And this virus, when they go to humans' bodies, they mutate. When they mutate, they become HIV. And HIV specifically target the T lymphocyte. And today we learned the T lymphocyte are like the Marine. They really do the hand-in-hand combat. And because their host is T lymphocyte, so they kill all the T lymphocyte. It's like your body don't have the soldier to do the fight, or a small infection can kill you. And when that happens, we call it AIDS. And the AIDS patient don't die because of HIV. They die because of any kind of infection, usually the lung infection. Because you cannot make the air super clean. Excuse me. And in the 21st century, because of the cocktail treatment, we can very effectively suppress the HIV virus to a very low level. So nowadays we treat HIV like a chronic disease, like hypertension or diabetes. Just routinely go to take the medicine and receive the treatment. And the average life of HIV patient is just a little bit shorter compared with average life of normal people. Okay, that's it.